We've talked about diagnosis and wanted to specifically see how would we address somebody with metastatic cancer that might be seen. Maybe we've all had patients with either metastatic lung cancer or, Yanni, I want to talk more personally. You've had exposure with, you were a pancreatic surgeon. So when we hear pancreas, we think of the worst. And so how do can you give us some examples in your practice of when, the connotations of what patients feel and how you speak to them and how do you prepare them for surgery and their outcomes?
When we talk about cancer, I want to make sure that everybody understands that cancer is not one disease. It is a million diseases. Even under the heading pancreatic cancer, cancer of one organ, you can have three completely different diseases. You can have cancer arising from the cells that line the tubing, the tubes of the pancreas, which is called adenocarcinoma of the pancreas. You can have cancer arising from the cells that control insulin and other hormones called neuroendocrine tumor of the pancreas. And rarely you can have a form called acinar, which is really from in quotations, the meat of the pancreas, from the very cells of the gland. So these three entities behave completely different. If you have adenocarcinoma of the pancreas, which unfortunately is the most common disease, this tumor tends to be aggressive. It tends to locally grow fast and invade surrounding organs. And unfortunately, 25% of patients that come to a doctor with this diagnosis are usually inoperable, either because it's locally too advanced or because it has spread to another organ. In this instance, with this disease, the only, it's very unfortunate, the only therapy is really a combination of chemotherapy agents that can prolong survival. Surgery is not an option. It's contraindicated, in fact. However, and that proves the huge importance of making the right diagnosis. If you have neuroendocrine tumor of the pancreas, they typically are not aggressive. They're what we call indolent. They grow slowly. And although they can give metastatic disease, usually to the liver, they are slow to grow. They're slow to claim the life of a patient. So for metastatic disease, for metastatic pancreatic cancer, for metastatic neuroendocrine tumors, we can give, surgery is indicated. You can remove the primary tumor from the pancreas, and in certain cases, if there is oligometastatic, the Greek word, most of us are Greek here, so oligometastatic, meaning low volume of metastatic disease, you can remove that. So you can understand that the discussion when you meet someone with metastatic pancreatic cancer is heavily based on the identity of the tumor. Now, we really want to hope that in the future, hopefully in the near future, we will have medicine, drugs, and immunotherapy that even the first type of cancer that I mentioned, the adenocarcinoma, which is it's a fast killer. We hope to be able to control that disease, to slow it down, and make it a chronic illness. And perhaps, in the near future, we will be able to offer surgery for metastatic disease of the pancreas or adenocarcinoma which currently is not an option. So I think it's very important to make the appropriate diagnosis. And the second point, really quick, I want to make is this. Cancer is a very complex illness. And it's not meant for one doctor to manage a cancer patient by himself or herself. You need a team of doctors. You need a team of oncologists. At major hospitals like NYU, we have medical oncologists, we have surgical oncologists, we have radiation oncologists, and several other disciplines. We all work together and we meet on a weekly basis to try to make as precise diagnosis as possible and then try to tailor the treatment plan for every patient. So even for the metastatic adenocarcinoma of the pancreas, there are a combination of drugs, and I will let Alice maybe elaborate a little bit on that can help. And when that first line of treatment fails, we have what we call clinical trials, new drugs that are in the pipeline coming out of the research laboratory that we can offer and potentially help.
I'm happy to help kind of discuss treating patients with metastatic cancer, especially metastatic